tissue culture bananas, 2,090 irrigation kits, and 93 greenhouses. 5, invested in agricultural machinery with additional 10 tractors purchased over and above 350 tractors operating in 29 agricultural mechanization stations in 2021. Fellow Kenyans, the county governments have also focused on the development and the commercialization of livestock sector as follows. Procured 10,782,369 doses of various vaccines for livestock vaccination. Conducted 369,788 subsidized health services. Procured 449,773 straws of semen. 4, distributed 4,376 cattle, goats, and sheep breeding stock. 5, installed 68 milk coolers. Well done. Introduced commercial poultry farming by supporting farmers with 1,608,108 improved kienyeji chicken. Further, the county governments have also given support to the fisheries sector by distributing 2,987,356 fingerlings to farmers in addition to 746,445 fingerlings distributed in 2021. Not to be left behind is the extension services. County governments reached out to 4,523,889 farmers. The said developments have been possible, notwithstanding several challenges, including the COVID-19 pandemic, increasing input and fuel prices, and erratic weather patterns and drought. May I now turn to issues arid and semi-arid lands and disaster management. Fellow Kenyans, may I at this juncture address the critical issues affecting persons living in the largest land mass of Kenya. These are arid and semi-arid lands, and the subsequent main challenges they face, that of disaster risk management, registration, and policy frameworks. To effectively achieve the goal of preventing, responding, and recovering from disasters, it is imperative for counties to formulate and implement policies and strategies which will guide the disaster management units on a pathway to attain DRIM objectives. 12 counties have enacted Disaster Management Act, while 10 counties have put in place disaster management policies. 13 counties have developed county emergency operation plans to provide a framework for coordinating preparedness response and recovery activities in the counties. The Council of Governors is working closely with the remaining counties to strengthen the legal and policy environment for disaster management. Now, let's move to county disaster risk management coordination structures. For the counties to operationalize the established DRIM policies and registration, it is paramount to establish strong institutions for implementation and ensure that there is adequate funding to enable the institutions effectively implement the DR strategies. 14 counties have established a Directorate of Disaster Management and allocated a cumulative total of Kenya shillings 158,814,553 to the Directorate to enable it to operate effectively. Well done. In addition, 8 counties have allocated 2% of the annual budget to the county emergency fund kit. 40 counties have established firefighting department with functional fire engines. No, I think that one is. The council recognizes the significance of the disaster management function in the counties and shall continue to provide technical support for operationalization of disaster management functions. Drought update in brief. Due to ravaging effects of droughts, households and livestock in ASL areas are subjected to abject suffering in the absence of sufficient food and water. The health of children across the affected counties is also negatively affected. Total number of people affected by drought in the counties is approximately 4.1 million, a big number. The county governments have initiated a myriad of interventions as follows. 2.7 million people benefited from the food relief distributed by the counties. Well done. Water tracking benefited close to 1 million, while 876,153 children who are under normal nutritional level were reached out during the period 2021-2022. Total number of vaccinated livestock during the period was 5,280,654. That is no mean achievement. In response to drought, most of the affected county governments and to redirect generously their effort to respond with urgency to reduce the effects of drought. That was a job well done. Now, fellow Kenyans, may I now address the sector which is very critical and sensitive to all of us. That is the health sector. County government have made significant investment towards ensuring that quality and accessible health services are prioritized and the citizens' right to health is progressively realized. The gains from sustained efforts in improving capacity in all health systems areas, including infrastructure, human resources for health, health commodity supply chain, and sustainable health financing are now demonstrable through improved health outcomes, e.g., maternal mortality has reduced from 116.4 in 2019-2020 to only 99.6 in 2020-2021 per 100 live births. A tremendous improvement. Neonatal mortality rate has reduced from 9.5 to 9.2% per 1,000 live births. There has also been a significant programmatic training to enhance capacity of health care service providers and development of enabling policies, guidelines, and strategies to steer the country in the universal health coverage journey. Examples include primary health care network guidelines, and two, Kenya Health Sector of Governors note that county government scaled up investment across all health investment areas, which include infrastructure, a lot of details here, which also include service delivery. May I very quickly go through it? The number of health facilities in the country has increased from 6%, from 13,190 in 2021 to currently 13,772. Of these, public facilities account for 46%, private facilities 44%, faith-based facilities 7%, and non-governmental facilities 3%. Across the 47 counties, there are 6 level 6 health facilities. Level 5, there are 886. Level 4s, level 5s are 23, sorry, level 5s are 23, level 4s are 886, and health centers are 2,180. 10,677 level 2 facilities, that is dispensaries. Healthcare services have been brought closer to the people. The county governments are now targeting having facilities at every 5 kilometer radius moving forward. an achievement which some counties have achieved. Across the 47 county governments, inclusive of private and Levaro facilities, there are 1,278 functional critical care beds. The improvement of ICU infrastructure is attributed to the county government mobilization effort during the COVID-19. Further, effort to increase the storage capacity of blood and blood products across the 47 counties and to ensure that there is adequate blood in cases of emergency have led to an establishment, and these are good news, of 12 blood transfusion satellite centers across 12 counties. The establishment of these centers will increase collection of blood to the tune of 65,056 pints. County governments continue to strategize to reduce the burden of non-communicable diseases. For instance, since 2019, with the support of the national government, 14 regional cancer centers have been established across the counties. 3 of these centers, Kisumu, Nakuru, and Garissa, are comprehensive, and they have increased screening and chemotherapy, surgery, and recently radiotherapy services for the people. Let's go to service delivery. The Council of County Governors notes a significant reduction, good news, of maternal mortality in the country since the inception of devolution. I can need a few figures to prove that, but they are all written. It's all here. The success rate we shall give to the press. Healthcare financing. There has been improvement in the budgetary allocation to health in the counties from that 2.8 in the financial year 2020-2021 to 34.3% in the year 2021-2022, which has ended. This is inclusive of funds received as conditional grants. Further, the conditional grants under the Transforming Health Services allocation increased to 3.9 billion from 2.6 billion. The overall absorption rate for the funds sent to counties since the first financial year of disbursement of 2017-2018 is very high at 89.5%. Well done. However, no disbursement of funds has been made in the current financial year owing to inordinate delay in approvals and enactment of the County Government Additional Allocation Act. And lastly, resources through Daninda support program will see counties get additional 701 million of this current financial year, with a condition of counties contributing 25%, which comes to 199 million as counterpart fund. Let's move on to COVID-19 management and response very quickly. During the last financial year, county governments made huge strides in response to COVID-19 pandemic, including strengthening of medical oxygen supply. This was a job very well done, which saw installation of additional oxygen plants for 1 additional critical care beds and ramping of COVID-19 vaccination at the county level, resulting in 8,637,095 Kenyans above the age of 18 being fully vaccinated as at 29th June 2022. Quickly, let's look at UHC update. In the scale-up phase of UHC, the national government set aside 6 billion to provide health insurance to the first cohort of 1 million indigent across the country. Several county governments have also strived to match the national government's effort to co-finance for the indigent through communities initiated schemes such as Marwa in Kisumu County, Oparanya Care in Kakamega, Makueni Care in Makueni, among others, with the aim of reducing the burden of catastrophic expenditure in seeking health care. So far, 1,201,835 indigents have been identified across 47 county government and counties, and 920,325 have been biometrically registered. Primary health care. As a strategy of accelerating the achievement of UHC, county governments are in the process of establishing primary health care networks to strengthen the referral systems and decongest the national level facilities. Currently, 13 counties are being supported by the development partners to establish primary health care networks. These are 12 of them: Turkana, West Pokot, Galiza, Samburu, Marsabit, Kisumu, Migori, Kakamega, Elgeyo Marakwet, Nakuru, Nairobi, Mombasa, and Kilifi. There are 8,778 community units, each with about 10 community health frontiers. The number of fully functional community health units are 6,191. The semi-functional ones are 2,239. And the non-functional ones are 348. We hope they will be functional soon. Human resources for health. Just 1 minute. Just a second. Human resources for health. There have been a tremendous improvement in the strengthening health services delivery by increasing the number of human resources for health. Financial year 2021-2022, 47 counties, all of them have accumulated and employed additional 767 healthcare workers across the various candas to increase efficiency in the delivery of health services. Fellow Kenyans, delivering the promise of a response health system will require county governments to increase the investment even further, despite the limitations of the current physical space. This explains why some of us want to go to the Senate to make sure we reach the 35% threshold to the counties, mara moja. The council will work closely with the national government and the Senate to address critical issues, derailing service delivery, continuously advocate for sustainable and innovative healthcare financing, as well as provide platform for continuous sharing of information and the knowledge amongst the counties on emerging best practices in the devolved health sectors. What the counties need is more money. Otherwise, they have personnel which can handle the running of the health services. Fellow Kenyans, may I now move on to another very critical sector to all county government, that is the finance. The Economic Survey of 2022 report indicates that the economy has recovered from the crippling effects of COVID-19 pandemic to expand by 7.5% in 2021 compared to 0.3 contraction in 2020, an improvement. The recovery was mainly driven by a resumption of most economic activities and lifting of the containment measures instituted to curb the spread of the virus. Regarding the county finances, the total projected revenue for budget implementation in the year 2021 and 2022 amounted to 467.7 billion, which consists of equitable share allocation of 370 billion. Additional allocation from both the national government and development partners, whom I wish to thank, amounting to 39.9 billion, and projected own source revenue by the counties themselves, 57.8 billion. Out of this allocation, a total of 340.4 billion has so far been dispersed to the counties as equitable share equivalent to 92%. And Kenya sharing 16.8 million, which is 51% of the 32.34 allocation from development partners. As of the first 9 months of financial year 2021-2022, county governments generated a total of 27.09 billion from their own resource revenue, which was 46.1% of the annual target of 57.8. This was an improvement, pongezi, compared to 25.52 billion generated in a similar period of 2020-2021. Well done, colleagues. Pending bills. This is the real elephant in the room. The situation was worsened